So as we get started, I'd love it, just invite you all to introduce yourselves in the chat, perhaps your role and what district or school or organization you represent, so we can start the process of all getting to know each other. So I see many familiar faces, but there are lots of you that I haven't had the opportunity to meet. So my name is Sarah Younggren. I am a clinical social worker and a school mental health consultant working with districts across Colorado in the support and enhancement of school mental health strategies. And I represent Finding Hope Counseling and Consulting, and I'll be your facilitator for this community of practice throughout this school year. So I'm excited to be here with all of you, really to be in this joint learning process together as we share our expertise and really work to build this network, build this community, and learn from each other. I'm also thrilled today that we get to welcome Samantha Reeves from the National Center for School Mental Health, who will be discussing what is and how to build a comprehensive school mental health strategy. I'm going to go ahead and share my screen, and we can get started. Well, I'm trying to. There we go. All right, so I want to start first by thanking our sponsor, Centura Health. They have really been a great supporter and are helping to make the community of practice possible for this school year. So I wanted to introduce Dr. Claire Eubing, the Vice President of Health and Communities and Wholeness at Centura Health, and invite her to just share in a few minutes Centura's work and their commitment to this effort and to school mental health. So Dr. Eubing, if you're on, I welcome you to unmute.
Morning, everyone. It's really nice to see everyone here. We at Centura are really happy to sponsor this forum. We know that there is a lot of mental health issues out there, not just in youth and children, but in adults as well. And the pandemic has not helped us at all in that. This year, Children's Hospital Association and the American Academy of Pediatrics declared a mental health emergency nationally for children. And very sad to hear that. But we're hoping that with these efforts, sharing knowledge, sharing tools and techniques, that this can be a support for everyone who's working at the school level, and that we can make a difference. So thank you, Sarah, for organizing this, and for all who are attending. We really appreciate the efforts.
Well, thank you, Dr. Eubing, for all of your support and investment in this work. So this effort has truly really been a statewide effort with a number of different partners that have really worked over the course of the last few months to build this community, build this idea, and really support the efforts in launching this so that we can all engage in shared learning. So I wanted to just take a minute to introduce our partnerships, our partners, and who's representing them today. So first is the Colorado School Safety Resource Center, and we're joined by Christine Harms, Director, and Katie Garner, Training Consultant. Megan Shelton is the Child, Youth, and Family Behavioral Health Team Lead with the Office of Behavioral Health. And then Partners for Children's Mental Health, we are represented today by Training Director Paige Backlund Harkeen and Brandy Davis, who is a senior trainer for Partners for Children's Mental Health. David McLaughlin and Michaela Carls are also here. David is the Vice President of Operations for Mental Health Colorado. And I just want to say thank you to all of you for your support over the last few months and really making this a statewide community. We couldn't have done it without us as a team. So a couple of housekeeping items just before we get started. I know this is a very large group, and so this is really up to your comfort level. So if you are possible, we really invite you to engage using your camera on. Again, if you feel comfortable, just so that we can get to know each other and really feel like we are part of a sense of community. Brandy Davis from Partners for Children's Mental Health will be our participant care and Zoom support. So if you need anything throughout this meeting, please reach out to Brandy. Her email is on the slide and you can also chat her directly. We are going to be using the chat box for our Q&A today, specifically during Samantha's presentation. And we will do our best to get to all of the questions after we hear Sam share her information. So again, because we're a really large group, we got really creative about how to make this interactive and to be able to hear everyone's voices through this process. So we'll be using something, a technology and a platform called Mentimeter, which there'll be some reflection questions that will come up on slides after our breakout rooms. And you will go to the website listed on the slide and enter a code, and then you'll be able to type in your answer or your thoughts, and they will start to scroll on the slide. So you'll see this in a few minutes. We will also have an opportunity to spend some time in smaller breakout groups today, again, to really build this sense of community and to provide an opportunity to share our learning, what works in our schools, what opportunities are there, and then we'll come back as a larger group and do some group sort of sharing and troubleshooting and mutual learning. Mighty Networks is going to be our online community platform. So this is where we can engage and communicate in between our live sessions. I will also be posting all session recordings, slide decks, and any relevant resources within Mighty Networks. And so immediately following this meeting, you will get an email from me with some instructions and inviting you to sign up and to be part of this community. So thank you everyone for completing the questionnaire, the survey when you registered about which specific school mental health strategies are of most interest and relevance to your work. So we will be using the results from this survey to guide and prioritize future sessions based on your interests. And you will receive communication from me prior to each session with the session topic and the presenter for that month. We all really want your feedbacks after today's session. This feedback really will help us make sure that we're meeting your needs, creating an open learning environment and community, and will continue to allow us to get support and to fund this effort in the future. So that survey will be provided in the chat box as we close out today. So our agenda for today, just to review quickly, we'll start with intention setting for this community. So what is our community of practice and what do we want to get from this? And then Samantha Reeves, again, from the National Center for School Mental Health, will present about comprehensive school mental health strategies and quality indicators and strategies to make change in 2 different presentations. In between those presentations, we'll break out into our breakout rooms and then come back for some whole group sharing and reflection. And then we will close together as a community with hopefully some inspiration as we go into our next month's worth of work. So what is this community of practice? And again, what are our community intentions? This community of practice was truly designed to bring together a large number, as you can see, of school mental health professionals and champions across the state of Colorado. And I think it's amazing we have these numbers, but I think what's even more significant is that almost all parts of our state are really truly represented. So there's just going to be a vast array of experiences and expertise that can be brought to this community. And our hope is that this space can be one of shared learning and collaboration, where we really learn from each other what works in our schools, what could work in other schools, and build off this knowledge and expertise that we all bring to the table. And we hope everyone has the opportunity and feels comfortable to share throughout this process. We really want your voices to be heard in whatever form feels comfortable. We also hope that you can commit. I know this is a busy time of year, but we hope you can commit to attending a majority of the sessions so that we can really work to bring us together as a community for the continuity of our group. So before we dive into our work today, I'd like to turn it over to Paige to lead us in a minute to ground ourselves.
Thank you, Sarah. I think we wanted to just name that it has been an unexpected and very eventful 18+ months. And we know that there have been many difficult moments in the last 18-ish months, and also a lot of opportunities to learn and grow. So we are so thrilled that you're here this morning. And I wanted to just start by asking everyone to allow yourselves to be fully here during our time together. And however you practice that of coming into the room or grounding yourself, just allow yourself to take a few deep breaths. Or if it's uncomfortable to be asked to breathe, if you just want to allow yourself a few moments of silence, just to really arrive here. And I want you to feel into your body and find a place of tension. And it might be in your jaw, or in your forehead, in your shoulders. And see if you can allow yourself to relax 10 to 15% right in that place. Just for now, let it go. I was at my local Starbucks this morning, and I was thinking about all of you coming together, and they had on a table a piece of poster board with some sticky notes in front of it and some markers. And the sign on the board was, "Leave a note that will make someone smile." And so my family and I, my kids, we walked over and we picked up a sticky and we left a note. So as we just open up today and we start to feel into this community, I want to invite you in the chat to leave a little note that you think will make someone else smile. And here's mine. You are looking good today.
We have your work is so important. There's always enough of anything you need. I love that. You are seen and valued. Thank you for being you. Our work matters always. Oh, I love this. We are in this together.
Well, thank you, Paige, for leading us in that and for encouraging us all to share something. I'm so inspired to hear all of that. Our work is so important. We are in this together, truly. And I think we're all just honored to be here with you all today to advance school mental health in our state. So thanks, Paige. So now we're going to turn to our first mentee question. So why are you here today? And what is your top wish for school mental health in Colorado? So what you're going to do is you're going to, on your phone or in another browser, go to menti.com, and you'll be prompted to enter a code, which our code is 3022-8641. And then you can just type in your answer, and the answers and reflections will start to appear on the slides and scroll, so we can really get a sense of where everyone is and what our commitment is and what our wishes are for our state's mental health for our students. And I believe the link and the code are also in the chat box. And we'll just give it a minute. I think it's wonderful to hear you all share, see it at least, and there are so many commonalities I think that I can see on the screen as they come in. A community where everyone feels we belong, prioritizing mental health for all of us and our well-being, to connect with each other. Well, I hope this platform worked for everyone. Like I said, we'll have a couple of different opportunities to share in this platform, but we'll get started now with our presentation from Sam. So Samantha from the National Center for School Mental Health, she's the assistant professor at the National Center for School Mental Health at University of Maryland, Baltimore. She works to combine her school mental health interest in early childhood and measurement to adapt what we have learned about school mental health to another setting and support our youngest learners. She's currently supporting state education leaders in both Arizona and Nevada as part of a school mental health collaborative improvement and innovation network with the National Quality Initiative. So Sam, thank you so much for being here today, and I'll turn it over to you.
Hi, everyone. It's nice to see and meet you all today. The things in the to Menti were fantastic. I think the National Center aligns with you as well in our goals to make sure that everyone has access to services and that we can share resources. We like to say that we want to share seamlessly so that nobody has to reinvent the wheel if we don't need to, and we can find easy ways to get resources to as many schools and staff that need them so that we can get services to kids everywhere. On our next slide, this too. One more, yep. So as Sarah did, I want to acknowledge that we are in an unprecedented time. And while we are here, it should feel reassuring to remind ourselves that there are some well-supported set of core principles and practices that we can and should hold on to, even during this time, including some of the core work we do around school mental health. So there are some nice strategies that have been tested and tried that can be things that we lean on now. And then there's this idea of some things that we might have to do just for now and be able to tailor and adapt our school mental health systems to meet the needs of COVID-19 restrictions and distance learning and social distancing. So in addition to those core practices, there may be some adaptations that happen at your schools or in your districts that help your school mental health system meet the needs of your school community. So this just provides the definition that we use when we're talking about comprehensive school mental health systems. And what this covers is both content and process. So we know that sometimes creating a school mental health system in schools can be challenging because it feels like there are competing demands, there are education priorities naturally and importantly, but servicing kids' mental health is an important aspect of their education as well. So we've just come up with some best practices and some supports that help you not only decide what content might be helpful in your school community, but the process for developing your team, for maintaining a comprehensive school mental health system. And generally, this includes having a full array of supports and services that promote positive school climate, social emotional learning, and mental health and well-being, and while reducing the prevalence of severity of mental health illness. And this usually spans the spectrum from our Tier 1 services that are mental health promotion down to our Tier 3 treatment services and support. We also want to build on the collaborations that happen at the school and district level as well. So the interprofessional nature of schools and communities really help to strengthen school mental health systems. So we want to build on those foundations as well and the strong partnerships that schools and districts typically have anyways, and be able to shape our environments and improve our environments so that they promote mental health and have a really great school climate for staff and for students and families as well. And to do that, on our next slide, the National Center for School Mental Health has developed 7 core domains that encompass our comprehensive school mental health system. And these include teaming, needs assessment and resource mapping, mental health promotion services and supports, or our Tier 1, early intervention and treatment services and supports, which include our Tier 2 and our Tier 3 services. Our Tier 2 are our small group or low intensity interventions for students who may be at risk or have shown some signs of having some mental health difficulties, whereas our Tier 3 is more akin to our traditional outpatient mental health treatment services. We also include screening. And when we talk about screening, we're talking about a universal screener. So a mechanism or a process for identifying students who may need services without knowing whether or not they have any risk factors. So it's a way for us to make sure that our school mental health systems catch any kids that might fall through the cracks through traditional methods of referral or assignments from like student support service teams. So a universal screener just gives us an added layer of protection to make sure that we are capturing the full scope of who may need what services. The other 2 things that are important to consider is documentation of our impacts and how we are funding and making our system sustainable. So we know that sometimes the funding and supports for school mental health can be variable. So as part of a functioning school mental health system, we also provide some supports and resources for schools to consider how they are getting their money, what they are documenting that can also help them in their grant applications or responding to funders or for state level folks, of being able to document what you're doing and how it's working for your school and your community. So those are our 7 core components that make up a comprehensive school mental health team, a system. And within those 7 domains, there are some core practices and features. So every domain speaks to figuring out a way to determine whether or not the interventions that we're using at our Tier 1, 2, or 3 are evidence-informed and culturally responsive. That's kind of a core component of the school mental health infrastructure, is what interventions are we doing and do they fit the needs of our community? Another important feature is partnerships and collaborations. There are many folks here from different lines of work, pressing buttons. There are different professionals here who work together on a daily basis with school social workers and community providers and school psychologists. So we know that's how schools naturally work, and we want to encourage those collaborations further. So having good partnerships with community members, with families is a core component of comprehensive school mental health systems. Needs assessment and resource mapping. This is our first kind of line for those data-driven practices. So using data to your advantage is a nice way to identify strengths, leverage resources in your school and your community, and be able to have a good idea of what the needs are for the students and families in your community. And using data and creating a needs assessment are ways to have an accurate picture of what's going on, where your strengths are, where your needs are, and be able to tailor your system and these kind of core components to your specific needs. Additionally, we know that to deliver interventions at those multiple levels, at those different levels of support, so that everyone gets the services they need, we need to be able to support our educators and our staff as well, and give them the professional development opportunities they need to be able to manage this kind of care system and support interventions as well. So these are just some of the core components that span the domains as well, of evidence-based practices, making sure things are culturally responsive, focusing on training staff, and using data to our advantage are some of those core components of school mental health systems. And the reason why this is an important focus is we know that schools are where students are receiving their mental health supports. It has become a common place where they are seeking services more so than outpatient and primary care. So being able to have some structure and best practices around our school mental health systems just allows us to address a problem that we already know is happening in a lot of schools, is that they are receiving a lot of the mental health supports that students need. So this just helps us get organized and be proactive around what we're doing and how we're doing it. And as I said, one of those core features for school mental health systems is to make sure that we're collaborating. So this is just a figure that helps us understand how we can use our community partners and our school-based staff to cover all of the different tiers. Oftentimes our community partners come in and help us provide those tier 3 services, whereas schools often take on more of the universal promotion, establishing SEL requirements or mental health literacy programming. So these are how we can use and support each other to make sure that we are meeting school needs. And to do that, I saw in the mentee that there was a need for resources. So I will put some resources in the chat so that you can gain some more information on what I quickly just covered. So one of the things that is a helpful place to start is the Bainham report on advancing comprehensive school mental health systems. It gives some state spotlights. It lets you know what other local folks have tried. Again, we are all about sharing seamlessly and stealing shamelessly. So as a part of a community of practice, we're here to support each other, and we conduct our work in the same way. So we like to provide spotlights and information on who's done what across the field as well. So the Bainham report is a nice place to start. On the next slide, there is also our SHAPE system. So it's the School Health Assessment and Performance Evaluation System. This houses several assessment measures that can help you inventory. It's the school mental health profile. It lets you inventory what services and supports you have available, who is on your school mental health teams, what data you have and how you're using it, that can be a nice place to start for your needs assessment of just taking an inventory of what we have and where we may be missing things. There's also the school mental health quality assessment on SHAPE, and that helps you see whether or not your school mental health system is aligning with best practices and gives you ideas on how you might want to go about improving your system. And there's also a resource and a screening library on SHAPE. So there are tons and tons of resources on how to write an MOU or design your team or select evidence-based interventions. So we tried to put as many resources as we could on the SHAPE system, and it's a free system that you can sign up for, and there's a resource list and a screening assessment tool library. Another resource was made possible through our collaboration with the Mental Health Technology Transfer Center. It helps states, districts, and schools across the United States understand core components of comprehensive school mental health and engage in a planning process around implementation of services. And it includes guidance modules that take you through all 7 of our domains. So that is also another resource if you want to dive deeper into any of the domains. That's a resource that's available. Again, it's free and online to support you around either building out your school mental health system or improving it in the places that you want to focus your time. Okay, so for the next few minutes, we are going to send you off to get to talk to each other. And I put some guiding questions that you might want to consider. You can look at some of those links that are put in the chat box that go over in a little more detail what the different domains are. But it could be a fruitful conversation to talk about what's kind of going well in your school or district and your site. Share your success stories and your resources with your colleagues. And it also might be nice to have a quick conversation on where do you need support, and what would be the one thing, the thing that would most move the needle in that area for you. And you can always put that back in the your needed resources back in the main chat when we come back together to see if any of your other colleagues have resources in that area. But these are just some guiding questions for you to think about as you're having your conversations around what comprehensive school mental health systems mean for you and in your area.
Great, thank you, Samantha. So we'll spend 10 to 15 minutes in breakout rooms, really diving into the information that was shared, but also just allowing organic conversations to happen as well about your work. And again, as Samantha mentioned, where you might need support or offer expertise. So I believe Brandy is going to move us into breakout rooms now. So as we come back from the breakout room, in some settings, we'd be able to share, each breakout room would have an opportunity to share something that they discussed. And since we're such a large group, we thought we would try this via Menti again this time. So again, if you want to go to menti.com and use the code and just type in a couple of words about what was one thing in your breakout room that really excited you about what you learned or heard from Sam, or really excited you about school mental health. Yeah. So many people are saying that there's a need that we all knew, but that there's also more attention and awareness of the need for these services and supports. Becoming a priority in the community. It sounds like many other districts are in the same place and are trying to figure out how to support teachers and staff during this time. I would echo that very much, and love to hear that, because I think that's exactly what we can really strive to do as a community here together. And someone requested in the chat box if the answers to these Menti questions could be saved, and I will work on that and make sure that they are also posted on Mighty Networks along with the recording and the slide deck. So you can see, because they come in quickly. So I'll turn it over to Sam now again for the second part of her presentation, although there are still more responses coming in, but again, I'll be able to share it with you. And let Sam talk about building and improving school mental health systems. And then we'll go into breakout rooms again for another opportunity to discuss with your group. So Sam.
All right.
Great, thank you.
It was great to hear some of the conversations happening in the breakout rooms. And it seemed like there was a acknowledgement and interest around staff well-being and making sure that the development or the maintaining of a comprehensive school mental health system is within kind of the responsibilities of our schools and doesn't feel like an extra burden. And one of the things that can be helpful for that is a reframe around mental health. I know it often feels like something very separate, it's traditionally been a different system than our schools. But over time, over the last couple of decades, they have been combined. As we saw earlier, many children receive their mental health supports in schools. So it is a part of our education system now, and figuring out a way to make that relationship a bit more symbiotic and that we are working across those two systems will help it feel less like an extra burden and more like what we do now as a part of education. We make sure that we take care of the well-being and mental health of our staff and students, and teach them to read, do our math, and engage them around the subjects that they need to be successful later. So it's kind of a whole child, whole staff approach that we're moving towards. And one of the strategies that can be helpful and that we use in our coin is the model of improvement from the Institute of Health. So on the next slide is a diagram of what that means. So we use one way around action planning and taking things small and generating buy-in and feeling like this is something that is accomplishable and a small enough task is to use a plan, do, study, act cycle. And this allows us to get our big overall goals, like we all put in the Menti at the beginning, right? We want services for kids. We want to have resources. We want to make sure they're culturally responsive, those big, large goals, and we break them down all the way to something, a task or a change in our day-to-day practice that can be ramped up later on. So we start really, really small to take on a piece of those larger goals that we all have for school mental health, so that it feels accomplishable, that it feels like we can make some progress. Whereas the big overall goals sometimes feel a bit overwhelming. So if we break it down into smaller parts, we can get some more momentum around it. So on our next slide, it's this idea that we dream big, right? We all have these big dreams for school mental health, and that they reach all kids and that everybody who needs them can be engaged. And we want to start small. So by starting small and building towards our visions for improvement, teams can steadily stay on track towards their quality improvement goals and not feel like it's too big and too cumbersome to take on. And one way to go about this is to use the school mental health quality assessment. So I think we dropped it in the chat as well, and I can put it in again. So at the National Center, we developed a school mental health quality assessment. It outlines our 7 domains: teaming, screening, tier 1, tier 2, 3, impact, funding, and needs assessment. always forget, make sure I get them all. And within the measure are key indicators. So for teaming, one of the important things to consider is that your team is multidisciplinary and diverse. And within that item, we then describe what we mean by that. So are you using recruitment and hiring practices to attract diverse team members? Does your school mental health team reflect the diversity of your students, family, and staff? Does it ensure representation of different groups? So within each indicator of using best practices, we describe them. So it gives you a nice place to start if you want to know, like, well, how do I improve my teaming? You can go right to the best practices within the school mental health quality assessment for ideas on how you want to move forward, or ideas on what changes would be helpful in improving your teaming practices. So one way is to start with the domain that you want to focus on. So to go through the school mental health quality assessment, you can complete all the domains. And the nice thing about SHAPE is that it allows you to do it either online. You can develop a school team. Everybody can go onto the SHAPE system and enter their data, and then it will generate a report for you that looks similar to the one on the slide. If technology isn't your thing, you don't feel like it, there's also a printable version that I stuck in the chat. And if it's not working for some of you, I can try to attach the PDF when we are in breakouts as well. But it will give you a report. It will let you know where you're at in certain areas. Green would be mastery, yellow is progressing, and red is emerging. And you don't always have to start with the thing that feels most hard. So if your funding and sustainability domain is a 2, but you're like, there's no way I can tackle that right now, I don't have the people or the support, that doesn't have to be the thing you start with to improve your mental health system. You can start on something that you're doing well at and want to continue to build on. So you can use something in your yellow areas or your green ones to build momentum, build motivation around it, and feel like you can get something accomplished. You don't have to start in the thing that seems most difficult to get going. So you can choose an area from that assessment to focus on. And then on the next page, what you want to do, is develop a change idea. So our change ideas are to think about really practically and really concretely, what change can we make in our day-to-day activities and what we do that is going to be linked to an improvement. So is it a time management issue? Is it changing when we meet? Is it changing how we meet? Is it offering a service that we don't typically have? Is it having a meeting that we don't do? So those, and we're thinking that small. You can think about what would be one change in my day-to-day that would have some impact on how we provide services to students and families. So we're thinking really practically here for our PDSAs of small changes that we can make in what we do in our day-to-day that can result in changes like improving how multidisciplinary our teams are, right? Is it how we recruit? Do we put out a flyer that we never put out before? Changes like that. Okay, so once you decide which big domain, which of our big 7 domains that you want to work in, you can go right into your quality assessment and choose a best practice. So on the next slide, it gives an example of what this looks like. So the change idea for this group was that they wanted to be able to continue efficient and effective school and community partnerships during distant learning. So that's what they were working towards. And as you can see, the different ways that they can think about tackling that is they can adapt communication mechanisms for remote learning to continue efficient and effective school partnerships during distant learning. They could adjust data sharing agreements to continue efficient and effective school community partnerships, right? So there's a number of different ways that you can be creative in this area to decide what change you're going to make is going to link to your improvement. And you can take those changes right from the school mental health quality assessment. So if you look at the little white box at the bottom of the screen, they pulled what they were going to change right from our assessment measure. So the change idea says they're going to adapt communication mechanisms for remote working. And the first bullet says establish communication mechanisms like team meetings, email communications to ensure ongoing and effective communication between school leadership and staff partners. So they pulled it directly from the school mental health quality assessment. So you can do the same. It gives you a guide, it gives you a roadmap of if you're wondering, how can I facilitate effective and community partnerships? You can look right over and decide which of these things do I want to focus on. And as you can see, you have different options about where you want to start. So you can start with communication mechanisms. You can start with data sharing agreements. You can pick whichever one might work for you. And this might also be a nice place to contact your colleagues or share on your community of practices of what things have worked for other people around making those changes if you're stuck between two. And what we want to make sure is when you're thinking about your change ideas is that you're connecting them to an improvement. So you want to keep that in mind when you're thinking of the change that you're going to make in your day-to-day. So if you're going to change from email to flyers for communication with your teachers, why are you doing that? So you're doing it to maintain effective and efficient community partnerships. So you just always want to keep in mind where you're working towards, what improvement it is that you're trying to work towards, so that you can make sure that your change is linked to the improvement you want to see. Okay, so yeah, there's some animation on here, Sarah, so you're just going to have to click through a couple of times. And two more. Perfect. So, so we've gotten down to our change idea. So we've gotten from our big idea to improve school mental health services for students down to we want to improve our teaming structures, and down to we're going to do that by adapting our communication mechanisms for remote work. And now we're going to get even smaller. So when we say small, we do really mean small. And I think this can be a way to generate some buy-in. It's not big things. So even getting as small as adapting communication mechanisms for remote work, there are different ways that you can test this out or go about that change. And that can be establishing a virtual huddle on Zoom. That can be testing whether or not you have your own Google Classroom link for your staff, or developing a school mental health team thread. So those are three different ways that you can break down the thing in the thought bubble even further to a smaller test, right? So tomorrow you could have a Zoom huddle, right? It's to think about something that you could do in the next 2 weeks. That's how small we're thinking. And you're just testing it out to see how it works. On the next page is an example of a worksheet that we use that helps people organize their PSAs. I like to think of them as like going back to science fairs when we were in 8th grade and testing out our volcanoes. So it's hypothesis testing. We come up with an idea, we're deciding on what we want to do and how we want to test it, and taking some notes along the way on what happened and what we're going to do next. So in this example, the one we've been following, they've decided that the domain that they're going to focus on is teaming. What they're hoping to do is to change their communication mechanisms to improve effective school and community partnerships. That's their big idea. They're going to drop that down even smaller to will team members attend the virtual huddles? What barriers are there to attendance? So they're going to test out this huddle idea. And they're going to briefly describe what that is. They're going to schedule the huddle, track attendance. And then you're going to do some predictions. As with most meetings, there's probably going to be some scheduling conflicts. There might be fewer people that show up. So that is just doing some testing of what to expect. One thing I will say is don't get caught up in the planning. So the nice thing about the small tests of change, the rapid cycles of improvement, is that you can just jump in. So you don't want to spend 2 months planning for your PDSA. You want to figure out, is there something small that we can do pretty quickly that can help us get some data on whether or not this works. So they're just going to set up their doodle poll, create member invites. And how they're going to track attendance, they're going to use attendance and see if it's better or worse than when they had in-person meetings. And then they're going to try it out. So in this example, 8 of the 12 people attended their virtual huddle, which sounds great, right? Most people showed up, but all 4 of their community providers didn't show up, which is counter to what we were hoping would happen, right? We're trying to facilitate communication, but something along the way didn't quite work out, that our community providers didn't get to our meeting, which is less than what happened when we were in person. So what they're going to do next is, instead of moving forward, right? So they did this small test. All they did was schedule a virtual huddle. It's a little change that they didn't do before, and it didn't work out as planned. So they can go back to the drawing board. So they learned that more coordination with a representative from the clinic is necessary for appropriate scheduling. So they're going to go back at the bottom, and they're going to change their scheduling procedure to see if it improves community provider participation. So instead of moving forward, right? So they've had this virtual huddle, 8 people showed up, and instead of saying, okay, we're going to do virtual huddles all the time because they work, we learned that our community providers aren't coming. So we're going to take a step back, and we're going to focus our next little change on just shifting how we schedule our meetings. So that's one example. And on the next slide, there's some animation on this one too. I think 3 more. Yeah. So another thing to remember is, like in our previous example, a failed test is fine. I know sometimes there can be a lot of pressure on schools and districts to get it right and to do it big and to do it now. This is really the opposite. It's small, and because it's small, you have some opportunities to make mistakes, or for things not to work out in a way that doesn't affect the 1,000 kids in your school or the 5,000 kids in your district. It was just one meeting. The meeting didn't work out as planned, so we can maneuver a little better, instead of if we had sent it out to everybody that this is a new way we were going to go about doing something before we figured out if it worked. So if it doesn't work out, it's still good information. All information is good information. If it works, great, then we can build upon that and move. If it doesn't work, that's still good information, and it lets us adjust what we're doing so that we can better improve for the next time. So because in this example that their assessment for it didn't work out, they could better figure out what they were going to do next in their small change. So they're going to change their scheduling procedures. And that one did work out. So then they scaled it up a little bit and did it with 1 family. Now they're going to do it with 5 families, right? So then you can scale things up once you realize that they're working. Okay, and on our next slide is just some reminders on why we test and why we test small. And this allows us to focus on the little things. It lets us evaluate costs and side effects of change. It might minimize the resistance upon implementation because you get more people involved, you're getting information along the way. You're asking 1 person, or you're surveying 1 student, or you're asking of 1 classroom. It's a small test of whether or not it works. So it allows us some flexibility. It gives us time to be able to see if the things that we want to do at scale will link to the improvements that we want to see, are answering the questions that we want to answer. It gives you a little more flexibility than when you scale up immediately. So we test. And the other thing to remember again is that it's okay if it doesn't work out, and it's good information. And I know sometimes it can feel intimidating to jump into the mental health space and the planning, and it feels like an additional step, but this way of going about it allows you to to take small changes, to try things out, to feel a little more confident in your process and your procedures as you move forward than you might feel if you had to do something at scale right away. So remembering that the small tests allow you some flexibility and the failed tests allow you to come up with better ones is a nice way it's a process of learning and a process of scaling up that allows us to make more sustainable changes in our system because we did all these small tests and worked out all the kinks along the way. Okay, so we're gonna send you back out into breakout rooms again, and some food for thought or questions that you might wanna think about is if tomorrow you were gonna go into your building or in your district and you were gonna change one small thing, do one thing differently, what could it be? What would be your small test to change? And if you're like, absolutely not, Sam, I am not doing this process, what are some of the hesitancies around engaging in these kind of small tests of change? What is, and how can your community of practice and the folks here support you around your improvement efforts?
Can we hear supporting school staff, data, teaming? Collaboration, a lot about how we use our teams. Well, great. And as I said, I will make sure that I download these answers to Mighty Networks. To our online platform, Mighty Networks, so you can see the group's answers and thoughts as we have come back as a group after breakout sessions. So as we wrap up today, again, I mentioned at the beginning, we'd really love your feedback on today's session. It's a 4-question survey that should take less than 1 minute and really will allow us to make sure that as we're designing sessions with our technology and with the forum, that we have your feedback and make sure that our time spent together every month is as valuable to you as possible. So the link to the survey will be in the chat box, and I will also make sure that's posted, if you don't catch it now, on Mighty Networks on our page. And then in closing, I just want to thank everyone for being here and for your commitment to school mental health, but also for your contribution to our conversation today and to engage in this community. So I wanted to read this quote as we begin to embark on the next month's worth of our important work. Children are living beings, more living than grown-up people who have built shells of habit around themselves. Therefore, it is absolutely necessary for their mental health and development that they should not have mere schools for their lessons, but a world whose guiding spirit is personal love. So as we go into the work for the month, I invite us all to really think about how we can be agents of change, systemic change and advocacy in our school communities, to really support the mental health and development of our students, knowing that our school systems can strive to be a world of personal love that embraces each child and youth. And knowing that the mental health and well-being of our students is a priority truly so that they can succeed in school and beyond. And so I hope we can just embrace this message and spread it to the schools and the communities that we all work in so that we can be a world of surrounding love for all Colorado students.